You have been having palsy discharge from the penis. You have been having pain in one or both of your testicles. You have been having, as a man, for a lady, you have been having irregular menses, abdominal pain, and also unusual vaginal discharge. Could it be that it is a sign of an infection, a sexually transmitted infection? Welcome to this YouTube channel. I am Patience Ejembi. In this YouTube channel, I'll be sharing with you on the topic gonorrhea. Gonorrhea is a sexually transmitted disease you have when you have unprotected intercourse with an individual who has this infection already. So you have gonorrhea as an individual when you have anal, oral, or vaginal sex with an infected individual. A man could have gonorrhea. A woman could also have gonorrhea. Even a baby can also have gonorrhea. How do babies have gonorrhea? Babies have gonorrhea if they are giving birth to mothers who are infected with this disease already, and this baby happens to be giving birth to vaginally. So through the birth canal, this baby would have gonorrhea at. Another very important tip you need to know is you can also contract gonorrhea from kids. It is funny, right? I'm also surprised myself. What are the signs and symptoms of gonorrhea? I will give you the signs and symptoms for both men and women. For a woman who is having gonorrhea, should be having painful urination. There's painful urination, there's irregular menses, there's abnormal abdominal pain. There's also increased vaginal discharge. Why for a man who is having gonorrhea, there's painful urination, there's pulse or discharge of pus mixed with blood from the penis. There is also pain in one or both of the testicles. There is also swelling of one or both of the testicles of an infected man. What are the other parts of the body that gonorrhea can affect apart from the reproductive tract of an individual? First, gonorrhea can affect the rectum, which is around the anal area. If gonorrhea should get to the rectum, what it causes, individuals who have gonorrhea and have gotten to the rectum, it causes straining. When these individuals want to go for bowel movement, which is defecation, they tend to strain. And if you've not watched my video on hemorrhoids, please watch it, as straining is one of the major cause of hemorrhoids. So when you strain cause of gonorrhea, your chances of coming down with hemorrhoids is high. So with gonorrhea, you can also have hemorrhoids. Gonorrhea also affect the eye. What does gonorrhea does to the eye, please? It causes sensitivity to light. It causes pulse discharge from the eyes. Imagine you are just standing on your own, or somebody is coming to see you and they notice a pulse is coming out from your eye. It's not like you're having boil or anything close to the eye, but you're having pulsy discharge from your eye. It is a sign that gonorrhea is already affecting your eye. Then there's also eye pain and there's unnecessary tearing of the eye. Fluid mixed with pus is always coming out from the eye of such an individual. It can also affect the throat. If gonorrhea should affect the throat, if gonorrhea affects the throat, it causes persistent sore throat. So persistent sore throat could be a warning or danger sign of gonorrhea. It affects the joints of the individual, causing septic arthritis. So what are the treatment measures of gonorrhea? Please, one major way of saving yourself from coming down with gonorrhea is abstinence. If you cannot abstain from sexual intercourse, try and use barrier method for every unprotected sex you intend to have. Think of the negative repercussion it will have on you. Although gonorrhea is a bacterial disease and it can be cured, but if it takes you time for you to treat this particular infection, for a woman, it can actually lead to pelvic inflammatory disease. If you do not know what pelvic inflammatory disease is, click on the same YouTube channel. I have made video on pelvic inflammatory disease, And the two most common cause of pelvic inflammatory disease is the bacteria that causes gonorrhea and chlamydia. So you need to watch pelvic inflammatory disease so that you know what gonorrhea can do to you as a woman if you have it. Long-standing gonorrhea untreated would cause PID, and this PID can also, it also causes infertility or delayed conception. So for the pharmacological treatment, another way you can also treat gonorrhea is going to get tested. When you are tested, they will be able to know the particular organism that is disturbing you, and with that antibiotics can be prescribed. Antibiotics like doxycycline would be prescribed, and you are expected to take it for the prescribed number of days, the right time, and the right dose you are supposed to take. I hope this video has been helpful in helping you know the signs and symptoms and even the route of treatment you can go if you have gonorrhea. Please, if you have gonorrhea, do not sit back on it, most especially if you are a lady, cause this will cause you infertility and to cause you PID. If you are yet to watch the video on pelvic inflammatory disease on this YouTube channel, please kindly watch it as it has relationship with gonorrhea. If you are yet to subscribe to this YouTube channel, kindly hit the subscribe button and do not forget to drop comments and like this particular video. Thank you.